Mr. Brown. My name is Meranda Morgan, and I am your student nurse, and I've just been asked to give you some education today about your disease. Is that okay? Okay, thank you. So, first, we're just going to talk about the pathophysiology of this disease. So, just what is it caused by? It's caused by airway inflammation and narrowing. So, your airway just gets really irritated and swollen, and it constricts the airways. So this decreases the amount of air that can be moved in and out of the lungs, which leads to air being trapped in the lungs. And this prevents airflow even more so, which causes a shortness of breath and a decreased ability to tolerate exercise. So you just get tired, doing things that didn't make you tired before, you just get tired doing now. Even things just like walking. Inflammation can also lead to excess secretions being produced. So you just have a lot of fluid and mucus in your lungs and airways. And you can't clear these, which even further reduces the airflow. And the small sacs in your lungs, called alveoli, lose their structure, and their job is to just allow for the oxygen to enter your blood and the CO2 to leave. So when they're damaged, we can't do that, and our oxygen supply isn't very good. So this disease is lifelong, and because it retains secretions, you are more likely to catch colds, which makes it even more difficult to breathe. So it's important to make sure that you are not getting any colds or any infections. This disease is diagnosed when your doctor asks about your history and symptoms, and they may even do a chest x-ray or a blood test to see the lungs and how they're working. One big thing that the doctor will ask about is your smoking history. Diagnosis is confirmed through this test called spirometry. This measures how deeply you can breathe and how fast it moves in and out of your lungs. So this test measures how bad the limitation of the airflow is. And it can also be used to monitor your decline. So some risk factors to COPD. Smoking is the main risk factor, especially if you've been smoking for a long time. The irritants in the cigarette smoke weaken the lungs and destroy those little air sacs that we were talking about, which causes swelling. Other risk factors include exposure to any other irritants, like any dust or chemicals that you may be exposed to at work, or pollution in the air is also a risk factor. So your plan of care for this, the goal of treatment is to prevent disease progression and manage your symptoms. The first thing we want to do, and our priority, is to get you to quit smoking. This will reduce the progression of the disease, and there are programs that can help you quit. The use of a nicotine replacement may be beneficial. I don't know if you've heard of like nicotine patches or the gum that you can chew. Exercise is also important. You should make an exercise plan with your doctor. Some medications that you would be prescribed are bronchodilators. These help open your airways and help you breathe. These are usually an inhaler. We may also give you a steroid to help reduce the inflammation. This is given with an inhaler too. We want to make sure you have your flu and pneumococcal vaccines so you don't get sick, like we were talking about. Getting sick makes it even harder to breathe. As your COPD gets more severe, you may need to be on O2, or you may need to be on oxygen. And this may start out just at certain times and then progress to you being on it all the time. And lastly, so you need to make some diet modifications with this disease. You should get into the habit of weighing yourself regularly to monitor for weight loss or gain. And you want to limit simple carbs like sugar and candy or regular soft drinks. You want to make sure you're eating 20 to 30 grams of fiber a day. Things like vegetables, nuts, and bread have lots of fiber. Protein, we want to make sure you're getting protein because this helps maintain the muscles that you use to breathe. So things like fish and cheese, milk, and eggs have good protein. Uh, so you want to choose mono and polyunsaturated fats as well with no cholesterol. These are things like canola and corn oil. Um, and you want to limit your saturated and trans fat. So this is things like fried food, fast food, vegetable oils, pastries, and cookies. And in addition to that, we want to make sure we're getting 6 to 8 glasses of fluid a day. And to make sure you're not getting too tired before eating, or when you eat, we want to rest before eating and make sure we're eating 4 to 6 small meals a day. And ensure to drink liquids after meals and not during meals. Do you have any questions? Thank you.